At the Taub Clinic in Birmingham, Alabama, Dr. Edward Taub and his team use operant conditioning to help victims of traumatic brain injuries. Virginia Garlitz is relearning to walk after her body was paralyzed by an AVM.
AVM is an arterial venous malformation, venous having to do with veins, nothing to do with the goddess. I was very disappointed to find out. And I had just finished a Spanish literature class and was sitting and talking to a student, and all of a sudden I just lost the left side. It's been very tough because what you take for granted for most of your life just isn't there anymore.
One of our central procedures is called shaping, which is a type of operant conditioning. It was developed in the context of operant psychology, behavior modification, and its essential nature is to take a behavioral objective that is just a little beyond the capability of a person at a given point in time. But you keep making it just a little more difficult so that the person doesn't fail very often, but you keep extending the behavioral capacity a little bit at a time, but in a very short period of time that can add up to a very substantial improvement in movement.
To shape Virginia's walk, therapist Jean Crago challenges Virginia to navigate over barriers. The therapy is intense. Even Virginia's subtlest improvements are reinforced with encouragement.
Good. Just keep walking. Good. Okay. All the way. That's it.
The therapist writes down the number of repetitions that the person does, the type of or the quality of the movement, and that is reported to the patient after each trial quantitatively. And this is very satisfying for the patient because they know that their improvement, which the therapist tells them about, isn't illusory. It is real.
Virginia's walking pattern has changed significantly. She's now able to advance the stronger leg and foot past the weaker one, and it has tremendous potential for continued improvement.
I always knew in teaching that positive reinforcement was important, but I didn't realize how important.
We know from research that getting positive feedback is very important to learning, and that if you get some negative feedback and some criticism, for example, from your teacher, that's okay, but you have to get a lot of positive feedback too, much more positive than negative, to make it a rewarding learning experience.